So now let's look at the strategies for nerve pain. Remember that nerve pain is often that deep, achy pain, travels down a nerve, whether like our sciatic nerve, like sciatica, or that carpal tunnel type of nerve. So for nerves to feel good, to be happy, if you will, they need four things. They need movement, space, blood flow, and they need information. So let's focus first on movement. So our phrase motion is lotion. So a healthy nerve generally can slide and glide like a wet noodle. And our nerves travel through spaces, they travel through muscle, between muscle, through fascia, and they are designed to glide and slide. And that's what happens with a healthy nerve. But if a nerve is now irritated, it can lose some of this built-in slack, this ability to slide and glide. And so doing certain moves that are specific to the nerve can help restore some of that slack. Our movement also promotes the flow of a very special fluid that's found within a nerve. So technically it's called axoplasm, and it's like a syrup river that's flowing both ways up and down our nerves. And this river of axoplasm helps with the health of the nerve, replacing some of those sensors that we talked about that get replaced every 48 hours. So movement just keeps that flow of that river of axoplasm going well. And very interestingly, uh, anybody who has diabetes, this can be very sobering. This axoplasm that's so important to flow can slow down by 4 to 8 times normal if we have diabetes. That's why it's so important to move as able. But it also explains why so many with diabetes have a neuropathy. The flow of that axoplasm has slowed down. So motion, any kind of movement, specifically exercises for the nerves, gliding them, aerobic exercise in general is good. Resistance exercise, any exercise you'll do is the exercise you should do. But there are specific moves that can be done for particular nerves, and good to do these throughout the day as directed. If the nerve isn't too irritable, good to do particularly right before bedtime, because nerves can sometimes act up when we're lying down. One thing to keep in mind when you're moving, you don't want to stretch a nerve. Meaning, think of a tight muscle. We can stretch a tight muscle. It's designed to be able to handle that tension. But nerves are quite irritable. And so producing a little tension on them might be okay, but too much tension actually reduces blood flow and the fluid flow, that axoplasm. So a glide, a basic motion of that nerve can be very beneficial and healthful to the nerve. But you don't want to stretch it too much. The next thing to keep in mind for nerves, you want to make sure that you're providing your nerves space, meaning you don't want to compress the nerve. You don't want to squeeze the nerve. Because as we mentioned, nerves travel throughout the body, and they travel through tunnels. They travel through different, let's call containers. They travel through muscle, sometimes between muscle, through the fascia. And if these containers, if these tissues, these tunnels are tight and they squeeze on the nerve, well, you're going to limit the flow of blood and that axoplasm. And it's amazing. It doesn't take much pressure to slow down the fluids in the nerve. Only 20 to 30 millimeters of mercury of pressure is needed to alter that flow. And just to give you a gauge, when you have your blood pressure taken, the cuff is squeezing at 150 to 180 millimeters of mercury. So very light touch on a nerve can slow down the flow of blood and axoplasm. So we have to be careful when we're using straps and bracing on a long-term basis. We may actually be compressing a nerve over time. And so one thing to keep in mind, we often hear the idea of a pinched nerve or a nerve being compressed. When we're first compressing a nerve, we generally don't feel pain. More than anything, we'll feel numbness or tingling. So if you ever sat on the toilet for too long and your foot goes to sleep, that's you basically compressing the sciatic nerve, squeezing it, and limiting the blood flow, literally stopping the blood flow. And the change happens fast in about 40 seconds, a minute. And once you get up, you get a little discomfort as the blood goes back down, but all normal feeling and movement returns. That's with a fresh compression. Now, if a nerve is chronically compressed, that can lead to inflammation in the nerve, fibrosis, that basically almost like a scarring in the nerve. That can cause pain. And so often you'll get a deep, achy pain in the trunk of the nerve. So you want to make sure you're not squeezing nerves. So proper positioning. So when we think of the wrist, one of the reasons why many people wear braces is it keeps your wrist straight, or what we call neutral. So keeping positioning ourselves in a way that minimize compressing of the nerves, or our posture. Making sure we move to open up the spaces. So sometimes the fascia or the muscles are tight. So rolling, foam rolling, lacrosse ball, working on loosening up tight tissue can provide space. Sometimes you'll have a compression of the nerve root, maybe let's say at the neck, and you're getting a numbness or tingling going down the arm. Well, there sometimes traction, manual traction or mechanical traction, lifting the pressure off the nerve can help provide space and minimize symptoms. Now, perhaps you've had a searing leg pain, a nerve pain that's not, as I've described, deep and achy, numb and tingle, but a searing, burning leg pain in your life that lasted for a while, that might have started after a back injury. And it's been found that sometimes the discs can have a mixture of blood with the middle part of the discs of our spine. And this creates an inflammatory fluid that leaches out onto a very, very sensitive spot near the spinal cord. I had mentioned it earlier, the dorsal root ganglion, that bundle of balloons tied on its side there. This very sensitive spot, if it has a lot of inflammatory fluids leaching onto it, it causes a tremendous amount of pain that travels down the nerve that is innervated by that bundle there. And so this is one of those situations where if it's inflammation driving this pain, an epidural steroid injection can sometimes help this. And that's often when these epidural steroid injections are effective for leg pain, when it's being driven by an inflammatory situation at the nerve root. So far for nerve pain, we've said the nerves need movement, so we want to do things that promote movement. The nerves need space, so we want to make sure we're providing the space. The nerves also need blood flow. And we could say nerves are thirsty for blood. This statistic really blew my mind. If you were to measure the weight of all the nervous system of our body, it only makes about 2 to 3% of our body weight, the brain, the spinal cord, all the nerves. So such a small fraction of our body weight, yet it uses 25% of our blood oxygen. So a small amount of tissue, but so much need for blood oxygen. And so when the nerves aren't getting enough blood flow, the sensors that measure blood flow are activated if the system is in need. So we want to promote blood flow throughout the nerve. So doing movement in general and then specific nerve moves will provide and promote that blood flow. But even just general aerobic exercise. So let's say an injured area has to be immobilized. Maybe you do need it casted. Maybe you have to limit weight bearing. Well, can you do things with the rest of your body that can promote general exercise, aerobic exercise, blood flow throughout your body, get your heart pumping? And like we said, mobilizing the nerve actually promotes the blood flow too. So a lot of the strategies to help one aspect helps the other. And a very interesting point, perhaps if you have neuropathic pain or neuropathy, maybe you felt more comfortable sleeping in a recliner than a bed. And there's a reason behind that. It's a very interesting point when it comes to blood flow. Because in a reclining position, your legs, let's say you have the leg pain, your blood pressure is higher when you're in a recliner compared to when you're lying on your back. Well, with higher blood pressure, you're just getting more perfusion of blood into your nerves in general. So if ever you found yourself more comfortable in your recliner, there's a physiological reason behind it. And so our last strategy for nerve pain is providing your nervous system information. And so our brain is always seeking out information on potential threats. And you can think of the nervous system as looking for threats on the outside. Our immune system is looking for threats that on the inside there. And so providing this system with information, helping it understand what truly is a threat and what isn't, can really help it recalibrate itself. So remember, we talked about these nerve sensors, that are trillions of them in our body, that have to be replaced every 48 hours. Now, the type of sensor that will replace the dead one is determined by a few factors. One of them is genetics, but another is the present needs of the system as sensed by our brain. So if we feel that we can't move an area, let's say our ankle or shoulder, wrist, whatever, our system will make sure we don't move it by keeping it more sensitive to movement. So our beliefs affect what the nervous system will do physiologically. And so having the right information, helping the system see that it isn't under threat or isn't under the perceived threat, or the threat that it perceived it was under. Perhaps the threat is not as great as it perceived. This information can really help in its recalibrating to allow for more motion and to allow for less pain. And so perhaps you're like many people, when you're in pain, you need certain questions answered. And if you get these questions answered, your system can just feel less threatened. And so often we want to know, what is wrong with us? Why am I in pain? How long will it take? What can I do? What can you do as a provider? How much does this cost? How often do we think about that? And the more information our nervous system receives, our brain receives, the less potential perception of threat. And so we get this information through education, just like this pain neuroscience education. And we think about the words we use. And an interesting test was done just on the power of words. So in the orthopedic world, there's something called a straight leg raise test, where basically somebody lies on their back and you lift their foot up with the leg straight. It's designed to see how the sciatic nerve is moving and how it's feeling. So in subjects without any symptoms of nerve damage or irritation, when the test was called a muscle tension test, the leg moved much further than if it was called a nerve tension test. So it was the same maneuver, but the wording, a nerve tension test, just sounds more threatening. And consistently, people were able to go less distance when calling it a nerve tension test compared to calling it a muscle tension test. In our next section, we'll consider strategies for system-wide pain and chronic pain.